Okay. Chapter 25. Care of patients with peripheral nerve and degenerative neurologic disorders. Just since it's before the lesson, just kind of like basic information, what's important to know, things I think is important to know anyway, and objective questions, objectives, whatever. Compare and contrast the pathophysiology of Parkinson's disease and myasthenia gravis. Parkinson's disease is the degenerative changes in the basal ganglia lead to the decrease in dopamine, so therefore the excessive excitation of neurons prevents a person from controlling or initiating voluntary movements. Myasthenia gravis is dealing with the acetylcholine specifically, and the acetylcholine receptor sites are attacked by an antibody, and as a result, nerve impulses are not transmitted and the muscle cannot contract properly. So Parkinson's disease, you have lack of muscle control. Myasthenia gravis, you have a muscle weakness. 2. Discuss treatments for Parkinson's disease. Emotional support, physical therapy, drug therapy. 3. Describe the nursing care needed for the patients with Parkinson's disease. Teach them about their medications, what foods they may need to avoid, what kind of exercise are good for them, that they'll need extra time to take care and finish tasks. They need to remove things such as loose carpets and throw rugs that will prevent falling. Anything involving falling needs to be part of their teaching care and in your care. Home care 4. Explain why multiple sclerosis might be difficult to diagnose. Multiple sclerosis is difficult to diagnose because you have periods of attacks and remissions, so you can be out of attack when you decide to go to the doctor, get it looked at, and there's no set diagnostic test that can be done to determine it. You can have a lumbar puncture done to check for a certain band inside your cerebral spinal fluid, or you can have a MRI done, which will look at your white matter. 5. Devise a home care plan for the patient with multiple sclerosis. That's going to deal with exercise, diet, ways to avoid infection, how to take their medications properly, what are the signs and symptoms of a cholinergic crisis and myasthenia crisis. So what kinds of things are you looking out for? They need to wear a medical alert bracelet. Yeah. Compile a nursing care plan for the patient with Guillain-Barré's disease. Care plan. Life support. You can only do supportive measures if they're under an attack of Guillain-Barré's syndrome. 7. Identify the differences between Huntington's disease and amyotrophic lateral sclerosis. Huntington's disease is your communication between brain and nerves is very strong, so you have fidgeting, constant movement until they become completely dependent. Whereas amyotrophic lateral sclerosis, there is a lack of communication between the brain and the spinal nerve, not spinal nerves, but in the nerves. So therefore, you're going to have severe muscle weakness, and they're going to need full-time support. 8. Illustrate the signs and symptoms of myasthenia gravis. Their most outstanding symptom is muscle weakness that's resolved with rest. Others involve diplopia, ptosis, that's really it. Muscle weakness, diplopia, and ptosis. Teach a newly diagnosed patient about the medications of Parkinson's disease. Know what those drugs are, if they're taking an MOAI, what kind of foods do they need to avoid, and why, what kind of drugs would they need to avoid, and why specifically, possible side effects, all the things you would need to go over. Diagnostic tests that might be ordered if multiple sclerosis is suspected, lumbar puncture and MRI. Okay. CAP, Parkinson's disease. There's usually a balance between dopamine and acetylcholine. The degenerative changes in the basal ganglia lead to the decrease in dopamine. The acetylcholine secreting neurons remain active, creating an imbalance between excitatory and inhibitory neuronal activity. The excessive excitation of the neurons prevents a person from controlling or initiating voluntary movements. Your triad of signs and symptoms for PD is tremor, bradykinesia, and rigidity. Treatment for PD includes drug therapy, physical therapy, and emotional support. Safety alert, caution when administering MOAIs. If your patient's taking an MOI, caution against taking foods containing trimine. Know what kinds of foods those are. Know that if you give them meperidine, it can cause hyperpyrexia. Box for me is 25-1, nursing implications for drugs commonly used for Parkinson's disease when giving a drug for Parkinson's disease. Check other medications the patient is receiving. Side effects of carbidopa, levodopa. Anticholinergic medications with meals. Selagelini, however you pronounce that, may increase the side effects of carbidopa, levodopa. And continually assess for worsening symptoms regarding possible side effects, adverse effects of the drug. Hypotension, urinary retention, inappropriate sexual behavior, mental status changes, insomnia. Anticholinergics cause dry mouth and constipation, so increase fluid and fiber in the diet. Teach the patient taking anti-Parkinsonian drugs. How to deal with orthostatic hypotension. Carbidopa, levodopa will turn the urine dark. Constipation's a problem. Surgical treatment, deep brain stimulation is the new thing. It's expensive though, but it has good effects. Complications include dysphagia, constipation, urinary incontinence, and insomnia. Know how to properly feed the dysphagic patient. PD patients need extra time to finish tasks, so plan accordingly. Know how to prevent falls and what Safety measures you can put into effect, such as remove loose carpets and throw rugs, grab bars should be installed, a raised toilet seat. Teach them about carrying hot liquids so that they don't burn themselves. Multiple sclerosis is a chronic inflammatory disease causing demyelination in the central nervous system, the most common causing demyelination in the central nervous system. Table 25-2, the 4 clinical progressions of multiple sclerosis. I would know that. MS signs and symptoms. MS is typically follows a course of unpredictable flare-ups that are followed by periods of partial or complete remission. The more common manifestations of MS are as follows: motor dysfunction, sensory dysfunction, problems of coordination, mental changes, fatigue. Treatment. You got different drugs you can take. But mainly your most therapeutic effects are centered on supportive measures to maintain resistance to infection, reduce muscle spasticity, and manage specific symptoms such as diplopia, speech disorders, muscle weakness, fatigue, and depression. They need to exercise because it'll relieve spasticity and improve coordination. Swimming is one of the better alternatives because it's less fatiguing when they're in water. Care depends on the severity of symptoms. You need to teach the importance of proper nutrition with adequate fluids and fiber in the diet. Help the patient and family establish consistent daily routine. Alzheimer's disease is a form of dementia caused by pathologic changes in the brain tissue of the patient. If you can remember that from psych, mental, whatever, you got it. Amyotrophic lateral sclerosis is a progressive neuromuscular disease characterized by degeneration of the gray matter in the anterior horns of the spinal cord and the lower cranial nerves. Your muscles get weaker and weaker and weaker. Difficulty swallowing and speaking. Only the motor neurons are effective. Death is usually due to respiratory infection and dysfunction as weakness and atrophy of the respiratory muscles impede normal respirations. The drug riluzole has been shown to slow the progression in certain patients for ALS. First contact with the ALS patient, do a thorough neurologic assessment. Guillain-Barré syndrome is a rare disorder, and it is not known, but it can follow viral illnesses. Authorities believe that the disease is a cell-mediated immunologic response preceded by stimulation from a viral infection, trauma, surgery, viral immunization, HIV, or neoplasm of the lymphatic system, cystomegaly, and Epstein-Barr virus are 2 viruses that have been linked to GBS. Reason why it's in this chapter is because it includes demyelization, inflammation, edema, and nerve root compression. Objective and subjective symptoms of GBS include mild sensation of numbness and tingling. GBS signs and symptoms: muscle pain, tenderness, aching in the shoulder, pelvis, and thighs. Progressive muscle weakness starting in the lower extremities and moving upward over 24 to 72 hours. Symptoms peak in about 14 hours. Pain is common. Diagnosis is difficult. You might have elevated CSF protein that peaks in 4 to 6 weeks. Medical treatment is mainly supportive, so you treat the symptoms and dealing with anything. Nutritional support may be needed. Assessment is the most important aspect of care during the acute phase. Motor progression of ascending paralysis. Assess respiratory function carefully and assess gag, corneal, and swallowing reflexes closely. During the acute phase, the goals are to sustain life, prevent complications related to immobility, and promote rest and comfort. During the static phase, there must be a balance of rest and exercise and no sudden changes in posture or position in case blood pressure suddenly stops. You may need to apply elastic stockings or sequential compression devices in order to prevent thrombophlebitis. Signs of thrombophlebitis are warmth, swelling, and pain in the extremity. Temperatures may be elevated. Rehabilitation involves physical therapy. You slowly increase exercise and activity. Poliomyelitis and post-polio syndrome, I don't care about that. Huntington's disease. It's a genetically transmitted degenerative neurologic disorder. Signs of Huntington's usually become evident fourth or fifth decade. The person with Huntington's progresses from being fidgety and restless to a state of constant movement. Voluntary movement deteriorates until the patient is totally helpless. Intellectual decline causes depression, suspiciousness, and eventual dementia. The words myasthenia gravis means grave muscle weakness. Autoimmune disease in which circulating antibodies is directed against the postsynaptic acetylcholine receptors at the neurologic junction. The antibody reduces the number of functional receptor sites and restricts the neuron uptake of acetylcholine. As a result, nerve impulses are not transmitted, and the muscle cannot contract properly. Symptoms include diplopia, difficulty chewing and swallowing, and ptosis, oropharyngeal muscle weakness, and weakness in the muscles of the neck, shoulders, limbs, hands, diaphragm, and abdomen. Muscles are stronger in the morning and become weaker with activity. Treatment depends on the severity of the symptoms. You can either deal with the specific symptoms or manage the underlying cause of the symptoms. Anticholinesterase therapy is the primary treatment for myasthenia gravis because it prevents accumulations of acetylcholine at the neuromuscular junction and temporarily increases muscle strength by allowing acetylcholine to work, but it is not a cure. Assessments. Assessment of respiratory function is a top priority. When assessing status of a myasthenia gravis patient, have the patient look up at the ceiling, watch to see if the eyelids start to move downward. This is often an early sign of the disease or that the medication is insufficient. Patient teaching, know that box. Know what you need to educate about. Oh, that goes in patient teaching, never mind. Box 25-2, signs and symptoms, cholinergic crisis and myastheniatic crisis. Know what they are and what can bring them on. Alrighty, well that sums that up.